Sex and gender are two terms we tend to use interchangeably in everyday life, but actually medically they refer to very different concepts. Sex refers to biological differences that are brought about by the expression of sexual chromosomes, and gender is the socioeconomic construct of being a man or a woman in a given society. The important thing here to understand is that both sex and gender are determinants of health. So the type of diseases you get, your access to healthcare, your response to treatment will be different whether you're a man or a woman for biological and cultural reasons. So it is important to study sex and gender in medicine to understand this, and that's why we need gender medicine. Sex and gender differences occur also in brain and mental disorders, both neurological and psychiatric. So these are super important, this field as well. There are diseases that are more common in women than men. Examples are a lot of neuroinflammatory disorders, like MS, for instance, but also dementia and depression. And we do have diseases that are more common in men than women, like Parkinson or ALS. And it's important to know these differences, and it's important to know there is not just the number of patients that can differ, but it's also the way these diseases are brought about, they present themselves, the symptoms, the progression, and the response to treatment. So sex differences are extremely important in the development of new drugs, and the study of gender medicine is absolutely crucial in the field of innovation for really finding new therapeutics. So we do have a lot of research in this field, a lot of evidence, but a lot more needs to be done. We need more education in this field, both in the medical sector and for the patients and the society. We need more investment. We need to have a holistic approach where we consider these differences at a biological but also at a socioeconomic level. So my call to action is that brain and mental diseases represent a humongous unmet clinical need. We are talking about diseases that are extremely prevalent and extremely costly to the society. There is this huge unmet medical need and need for innovation. So I do believe that studying sex differences and implementing gender medicine offers an opportunity, a chance to innovate the field, to develop new tools and therapies and treatments for patients in the direction of precision medicine.